It's a very good question. I mean, this is a fascinating virus. In some respects, it's a respiratory virus that everyone will be familiar with because they or their children, I'm sure, will have had colds and coughs and the flu and similar infections. But on the other hand, it's a respiratory virus, or a virus that hasn't read the textbook about how it should behave. So it's doing some unusual things that are scientifically very interesting, but also have implications for how we approach it, especially in children. So, for example, unlike influenza or RSV, which is another common respiratory virus we see in preschool children particularly, this is a virus that really generally leaves kids untouched. So kids, they seem to be infected at a rate less than adults. So when we go looking for the virus with those nose and throat swabs and use very sensitive techniques, molecular techniques to look for the viral RNA, we don't find it as often in children as we do in adults. And even when children are infected, they have no symptoms often, or very few symptoms. That's really in contrast to what we see with other respiratory viruses. And then in adults, when the adults who are severely affected and have the worst outcomes seem to be those who are older, but also those who have a number of other pre-existing medical conditions. The cardiovascular and metabolic conditions pre-existing seem to put those adults at particular risk. This is a virus where every day you wake up to a barrage of new information about this virus, some of which turns out to be wrong, some of it turns out to be true. So we're constantly learning about this virus. In terms of its infectivity to others, initially it was thought to be highly infectious. So for example, if one person had the virus, they would then infect maybe 3 or 4 other people. It's a little unclear whether that's strictly true. It certainly is very infectious, but there are certainly families and scenarios where it seems to be less infectious, but also, of course, we've seen a number of well-documented outbreaks in relation to return travelers or workplaces. So it's clearly an infectious virus. As you say, it does seem to be spread both by aerosols or droplets when people breathe, cough or sneeze, but also can survive on surfaces for a number of days. So potentially a very infectious virus, which is why the public health measures such as regularly washing your hands, social distancing, getting tested if you are at all unwell, even with very mild symptoms, are absolutely crucial to try and reduce the spread of the virus.